we got tested, I think it was originally, we did the drive-through test on the 28th. And on the 30th of December, we all came back positive.
The loss of taste was probably the bigger indicator that I should check myself out for COVID.
Felt really sick and felt like I might just fall down. I was just really weak.
I could barely walk from the bedroom to our living room. My legs felt like jelly. It was so strange for me.
That was a really hard time because knowing that just one of my risk factors put me at a 24% chance of dying.
You hear horror stories, you hear, this person was in the hospital for this long. I mean, the guy across the street from me, for my business, he died of COVID.
I was admitted to the hospital, and that was pretty frightening because the doctors kept telling me how they expected me to get worse. Throughout the COVID pandemic, knowing that I was very high risk, I really tried to keep up with the latest news on treatments and therapies. And one thing that I had seen were the use of monoclonal antibodies.
When my doctor brought up infusion therapies to me, I'd heard stuff, I'd heard good stuff, I'd heard bad stuff, but I wanted to, like I said, I wanted to do anything I needed to do to not have COVID just run its course.
I received my monoclonal antibody therapy at an infusion center about an hour away from my home. It was specially set up just for COVID patients.
It's just as easy as getting a shot or an IV. You just sit around and wait while it goes in, and it's easy.
During the infusion process, I felt pretty good. I didn't have any side effects.
I don't like anything with any doctors at all, but for, this was real easy, and it was in and out. It wasn't hard for me at all.
By the next day, I was able to start getting out of my bed, going to the bathroom, working with physical therapy and occupational therapy, and still never needing any oxygen.
The next day after the infusion, I felt a lot better. All of my symptoms except for fatigue had already improved.
I felt so much better. Only 2 days after the antibodies, I was amazed. I was absolutely amazed.
The heaviness that I felt in my chest and just the sluggishness that I felt all around, I started feeling better.
My oxygen never dropped below 93%. I never had to go on a ventilator. I never even had to go on oxygen by nasal cannula or any oxygen at all. I never got worse.
I mean, yes, the science is new, the technology is new, but that's okay. New is okay.
The best thing to do is to get it as quickly as possible because you won't get as sick and it'll work faster to clear up your symptoms.
This infusion therapy with the antibodies can save lives.
We have even made plans for our elderly family members to be able to get it should they need it. I recommend it without hesitation.
I definitely recommend the antibody infusion therapy to anybody who gets sick. And I've been telling my friends, if you get sick, to call right away and get it, because the faster you get it, the better.
Just spread the word that this treatment is out there. There is, I'm not sure if we'd call it a cure, but there is treatment that can help us feel better much faster.
Talk to your doctors about it and see where you can get it done. And my advice would be to go get it. I would tell my family to get it. I would tell my friends to get it. And I say go for it.